I'm a physio, like everyone's standing and moving, so feel free to stand and move as we go through this talk. I might be glancing behind me at times just to check what I've got on my slide. I don't know that my eyes are that good to see that screen, but it's nice to see you all. It's nice to see such a big group here together. Often I educate people one-on-one, but it's nice to actually have you all together in a room. And it's nice to see full faces of some people that I do see. So I've never seen some of your faces before, so that's nice without a mask. So, just see now. Yeah. Now I'll try and just click on the
other side. Yeah, that's it.
There we are.
Is that yours?
Yep. Lovely. All right. So my topic today is lymphedema. It's hard to know where to pitch it, and looking down I can see people who are on the screening program, so without lymphedema, maybe just hearing about it, people who have lymphedema. So we've got a mixed bag here. Hopefully there's time for questions at the end and we can get into some of your individual questions. But I think for those kind of new to this whole area, it's important just to touch on what is the lymphatic system. And the lymphatic system really is one of those unsung heroes of the body. It sort of chuffs away and works hard without us giving it any appreciation or any thought. It's often, if you Google it, it's often illustrated in green. It's a system that complements the arterial system, so the veins and the arteries. It's got two functions. It mops up excess fluid that leaks out of veins and arteries or isn't needed by those systems. It takes it and it returns it back into that system, ready to go around the body again. Another important function of the lymphatic system is in our immunity. So what happens with a normal lymphatic system is the excess fluid moves from one place of the body towards the lymph nodes. So we'll talk a bit about lymph nodes today. The lymph nodes are the cleaning centres for the fluid. So lymph fluid contains bacteria naturally, and the lymph nodes will clean that fluid out and then deposit it back into the venous system, and then the heart will pump it around the body again. So that's what the lymphatic system is for. It's really important, and we don't appreciate it until we don't have it working well. So lymphedema is an accumulation of this lymphatic fluid in the system. So for one reason or another, and in this room it will be because of secondary lymphedema, because of removal or damage to lymph nodes. So there's a blockage, there's a change to the normal system. And what happens, I guess, is just simply a backlog of fluid. So if you kind of think of the system a bit like a road system, there's roads when lymph nodes are removed that are blocked off. The other roads can't actually divert the fluid, and you end up with a backlog of fluid. So that's it in a very basic way of thinking. How it presents, so it can be different for everybody. You might see it, you might feel it, and it might be a swollen finger, it might be a swollen upper arm, it might be in your breast tissue. It really varies, and I guess that's why we get involved early. We can help you identify early signs and symptoms. So I'll just move on. So the signs and symptoms. So what you're looking for, and this can be a little bit confusing after surgery, because after surgery you will have pain, you will have tightness, you'll have symptoms, sometimes numbness, tingling, and you're trying to decide, well, what's normal post-op symptoms and what's a sign of lymphedema. Typically, lymphedema will feel like a heaviness in your arms. So if you think of that extra fluid collecting in the limb, it'll feel heavy, it'll feel full, often you'll feel a tightness. So maybe a wristwatch, you have to go to the next buckle of your watch. You can't get your ring off as easily. Maybe your sleeve on that side feels a little bit tighter than the other side. There's some of the symptoms if you're getting lymphedema actually happening in the arm. What's that written on there? they're the things that I suppose if lymphedema is developing, you'll see. There are some signs that we can pick up before it reaches that level. So things that we can pick up in the clinic that you won't notice yourself. And that's where I guess lymphedema is in a good place now. We've got tools and we've got training and education to actually pick it up before you'll feel it yourself. Unfortunately, we can't screen everybody every month of every year, so we need to have you guys on board with picking up the symptoms as well in between your screening sessions, so that between us we're picking up as much as we can, as early as we can. So risk factors, I'll brief you through these and then I'll try and kind of demonstrate what it looks like in the body. So I guess in this room again, the most important risk factor is the surgery that you've had or are going to have. Surgeons these days really try and do as little as they need to, so as little as is necessary, but as much as required. So in terms of the number of lymph nodes, that is a direct risk factor for developing lymphedema. Sentinel lymph node biopsy, so that's the minimum, so the first few lymph nodes. Your risk of developing lymphedema is low. It's between 1 to 5% if you've had a sentinel lymph node biopsy. If you've had a lymph node dissection, so that can be broken into level 1, 2 or 3. So the lowest being 1, the mid being 2, the top level being 3. Your risk goes up more for that. So there's more roads that are closed, there's more potential for that backlog of fluid. So 4 out of 5 women who've had a full lymph node dissection won't develop lymphedema. So it's about a 20% chance on its own if we're talking about the surgery alone. The 2 other strongest correlated risk factors that have come through the research, and there is more research being done on this all the time, which sometimes gives us more questions than answers, but what has come forward is being overweight or obese is a risk factor, and picking up or having recurrent infections in the involved arm or side is another risk factor for developing lymphedema. A few other things have kind of crept in over the time as well, and these are somewhat anecdotal. There might be some research backing them up, but things like prolonged period of being stationary. So if you're doing long haul travel, sometimes that's noted as a risk factor. I'll talk a bit more about that later because I think that's an important one. Having a sedentary lifestyle, so again, kind of goes hand in hand with how you can prevent this from happening, but if you're more sedentary or you're not using your arm normally after surgery, you're more at risk of developing lymphedema. The treatments that go along with your surgery as well, so if you've had radiotherapy or planning to have radiotherapy, that increases your risk as well. Especially if it's involving the lymph node region, so into the armpit. So if you're just having it over the breast, it doesn't increase the risk hugely. If it's involving lymph nodes and right into the axilla, it's a similar risk factor to having the nodes removed. Chemotherapy, so some types of chemotherapy have been shown to have a little bit more of an impact on your risk of lymphedema. So if you've got a taxane-based chemotherapy, so docetaxel or paclitaxel, that increases your risk. The reasoning behind that is it generally increases the inflammation of the body, so you'll get a bit fluid overloaded in general. Which probably brings me nicely on to just demonstrating a little bit about how lymphedema might work in your body. So bear with me. No, I think I'm all right. So I'll try not make a mess. I'm sorry that it's red. I just thought maybe it might be easier for the people down the back to see red fluid rather than clear. It's the only food colouring I had in my house. Lymph fluid is clear, so it's not red, it's clear. All right, so I just wanted to demonstrate, it's like a bit of a science experiment. That's all right. Okay, okay. So The lymphatic system, a bit like lots of systems of the body. So if we think about the heart rate, your heart rate will work at about, your resting heart rate is quite low, 60 to 70 beats a minute. You've got a huge reserve if you have to flee a building really quickly for that heart rate to go up to cope with that extra stress. Your lymphatic system is similar. It sits at a low resting level and normally doesn't work at its capacity. Every individual's capacity is going to be somewhat different, okay? So my capacity might sit here. I'll pick on a few people I know. Julie's capacity might be a little bit lower. Karen's might be a little bit higher. Everybody's is different, and that's what we don't know. So we don't understand, we can't see that. So when you start, what's your capacity for more challenge on your lymphatic system, okay? So if we think about the lymphatic system's current working capacity, this is what you've got in reserve. If you overflow, you're going to get lymphedema. So is everybody with me on that? Yep. Okay, so say we start here. Adding more stresses on the body. So if we think, okay, you've had your surgery, you've had lymph nodes removed, let's put a little bit more stress on the lymphatic system. If you then go into a period of chemotherapy, potentially there's a little bit more work for the lymphatic system to have to deal with, okay? Radiotherapy might come next. There's a little bit more from there, okay? What we're trying to do is balance what we're putting onto the lymphatic system and what we can take off the lymphatic system as well. So it's not all bad news, and the things that we can do to intervene will actually start to tip some of this load off the lymphatic system again. Okay? I think the most important thing to think about here is where you start is the unknown, and that's why we often say we don't know who will develop lymphedema and who won't, because there's so much of that uniqueness to all of us and our systems and what our current capacities are before we start. Does that make sense? Yep. So we might come back to this in a bit. Okay. So early intervention and self-care. So the prevention is better than cure. And that's very much where lymphedema management is going now. It's let's screen you early, let's pick it up as soon as we can, let's intervene with easy things that you can do at home. Let's try and prevent it from developing. If it does develop, let's treat it early, let's keep it manageable. You may have heard that lymphedema can be classed into stages. So stage 4 being quite severe and irreversible. We're trying to keep everybody out of stage 4. We're trying to keep you in stage 1, maybe stage 2, but keeping it in that manageable phase where you can do something about it and you can live a good quality of life with lymphedema. So the first thing, I guess, is to come to you screening. So if you've got these appointments, you've got physio appointment, lymphedema, you don't know what that's for, come along, we will explain it to you. We will schedule quite a few appointments for you, but we'll try and keep them brief, and we will try and tie them in with other appointments that you've got. We understand there's a lot going on. It is important. We will try and work with you as best we can to get it done without adding more load. Know the symptoms, so know what you're looking out for so you can monitor yourself. In between screening appointments, you can say, something doesn't feel quite right, I think I need to go and get myself measured again. So know what you're looking out for. Skincare, now I will touch on that again, but avoiding infections. So trying not to get to the point where you've got an infection in your arm, you've got cellulitis, and cellulitis is an infection of the skin. So it's nothing to do with cellulite, so cellulitis, infection of the skin. So things like just basic skincare, being a little bit more, we don't want you to wrap yourself in cotton wool, we want to get out, do what you want to do, but just be a little bit more mindful of that arm. If you're in the garden, wear gloves. If you're, doing something boisterous, wear long sleeves, anything like that, just preventing knocks and bruises, cuts and grazes, that kind of thing. So avoiding that infection from getting in there, because we know infections can trigger lymphedema. You can put a bit more water in that cup. So practical tips. So things, everyday things, and there's small things that all add up to tipping some fluid out of that container and just giving your lymphatic system a little bit less to do. Skincare, look after your skin. It's the only barrier between you and your lymphatic system. If you're hard on it, your lymphatic system has to work harder. Simple things like get a moisturiser, put it next to your toothbrush, a little bit of a moisturiser every day. What else have I got there? Sunscreen. So if you're going, I've had lots of people come in and they're heading off to the sun again. Wear your sunscreen. Don't get sunburned. Wear your insect repellent. Try and limit trauma to the arm. Avoid tight-fitting things. So let your lymphatic system breathe if you like. Let it work. Don't compress it in spots. So trying to let it do its thing. Exercise. So staying active, finding something that you enjoy. I think the next talk is about exercise. It is so key. It's got so many benefits, and it is medicine really for the body in so many ways. It will help prevent lymphedema. If you've got lymphedema, it will help you manage it. It's almost compression from the inside of the body out. Other things, wearing gloves, getting on top of cuts and grazes and nicks and things really early. Put a bit of betadine on. Try and watch it, protect it. If you're in doubt, get to your doctor. Screening. So we've got a screening clinic at the Launceston General Hospital. We will try and screen, we will screen every referral that we get. Basically, a lot of the research is coming through Macquarie University now. They've put a lot of resources into the benefits of screening, and what they've found is that with appropriate screening using our LDEX machine, which I'll talk about in a moment, 92% of patients are not developing ongoing lymphedema. Now, 8% still will, but 92% are not. So that is huge, and again, a big push for prevention is better than cure. So it detects lymphedema at what we call a subclinical level. So before you'll feel it, before you'll see it, our technology now will actually detect differences in the fluid level of one arm compared to the other. So some of you have gone through this already and will understand what I mean. Here's our SOZO machine. So we've got one of these at the hospital. There's one in Imbalance in town as well. Some of you may be accessing that for screening. This is sort of our gold standard of screening for lymphedema at the moment. You stand on the machine, it puts an electric current through your body and it tells us a number. Is there more fluid in one arm compared to the other? It is not the only tool that we've got. I had a lady this morning and we could not get it to work. And it can be stressful because if that's all we had, we'd say, well, we don't know, but there's more that we can do. My teacher for lymphedema said, your eyes and your ears, eyes and your hands are the best tool that we've got. So what we see, what we feel tells us so much, and it's all they had 10 years ago. Tape measures, so if there's a 2 centimetre difference in your circumferences one arm to the next, that's a sign that there's something happening. What else? Yeah, the lymph scanner. So I won't show you the lymph scanner, I've got it there. It's a little device that shows you where the swelling is sitting in your body. It's a little bit more point specific than the LDEX. Screening generally is done for 2 or 3 years. We try and spread the appointments out as your time frame goes on. So the further you are from surgery, the more spread your appointments will be. Again, it's dependent on your risks, it's dependent on your numbers, it's depending on how you're going. I'm just mindful we're running out of time. There's probably questions in the room, so I'll squeeze through the rest here. So treatment for lymphedema, look, if we get to the point where we have to treat it, it's very person focused. Our core 4 things are ongoing good skincare, ongoing exercise, compression, and you may have questions about compression. There's lots and lots of options out there, but adding compression to the mix if lymphedema is there is a mainstay of treatment. And education, so understanding, knowing your body, knowing what you need when you need it, and we'll work through that with you. Services in Launceston, so myself and Emma with the 2 physios there. Tracy works privately. So some of you may have met Tracy. There's not many more of us. There's a few here and there that have some training, but we're limited. So if your screening appointments come up and we're seeing you quickly and we're in and out, it's because you're going well, you're fine. If there's a problem, we'll see you for longer, but we just have to get through everybody. So that's why sometimes your appointments might be quite quick, is we just want to make sure we're getting in early, we're screening, we're preventing with everybody. The Lymphoedema Association do have a register of accredited lymphedema practitioners locally as well, so you can always check that. Lots and lots of education and training is going on for lymphedema therapists at the moment, so there may well be more coming on the scene, but we can tell you about that too. There's just some supports there as well. So as I mentioned, the Australian Lymphoedema Association has lots of resources. There are some support groups as well. We'll generally give you advice on that as a case-by-case basis if it comes up. But there are some supports. There's a Facebook page that's quite supportive. Some of them can be a little bit negative at times, but this one up here is quite supportive and positive, and just gives some peer support and ideas and personal experiences as well. The NCBA website also has the My Journey document as well, so they've got some resources there on lymphedema as well. So I hope that was helpful. Has anybody got questions?